Hello friends, in this video we are going to know about the secret behind COVID-19 deaths, which is cytokine storm. Even during Spanish flu, millions of people died not directly because of the flu, but because of the cytokine storm which was induced by the flu. Similarly, in the case of COVID-19, many of the deaths are not happening directly because of the virus, but because of the cytokine storm which is induced by SARS-CoV-2 virus. In this video, let us know about the symptoms, how we can detect it, and are there any medications for it. And most importantly, we will know some of the precautions that has to be taken while a severe patient is getting treated or recovering from COVID. So please don't skip the video and watch this video till the end. Acute respiratory distress syndrome is something which is very much associated with COVID-19. 20 to 41% of hospitalized patients go through this syndrome. But ARDS is not specific to COVID-19. It happens in most of the lung diseases. But what is observed is that in many severe COVID-19 patients, death is happening because of heart failure, renal failure, liver damage, septic shock, multi-organ failures too. And this is most oftenly not by the virus, but by the cytokine storm, which is induced by that virus. Let us know about cytokine before knowing what is cytokine storm. Cytokine basically are small protein molecules which are present in our blood. They are signaling molecules and they convey different messages to different immune cells in our body. So basically cytokines are the molecules which are present in our blood, and when an inflammation occurs in our body, these cytokines will inform immune cells to reach the place of inflammation and treat it. But during cytokine storm, what happens is huge amount of cytokine rush towards the infected area all at once. And this cytokine storm is not a new concept. It happens in many other new kind of virus and other diseases. And it is common in autoimmune diseases or hypersensitive reaction in some people. But why this happens is because our immune system don't know how to fight the new virus. Just as in the case, India gone for complete lockdown in the first wave when the cases were few. It's not about whether the decision was right or wrong. It's because we didn't knew the nature of our enemy. So we took an extreme step. Likewise, cytokines take an extreme step and start getting produced in huge amount. Though cytokine storm is not very deadly in general, but in COVID-19 patients it is becoming a little more deadly because when our lungs is affected, when oxygen supply is not right, we will not have much time to react. Let us know exactly how it happens. Here is a healthy alveoli. If you don't know what is alveoli, let us consider it as a basic unit in lungs. What happens in normal condition is that blood flows near the alveoli and get oxygenated and pass through other parts of our body. But when our lungs or any other organ is infected, what happens is that the blood vessel which is going near will start producing cytokines, which is a signal for immune cells, and they will come and reduce the infection or fight against the infection. And one of the interesting thing that happens is our blood wall get thinner and start forming gaps so that the immune cells can pass through it and treat the affected area. This is normal reaction for inflammation, but what happens when cytokine storm happens is that a lot of cytokines rush through the blood, which makes our blood vessel very much thinner and start forming a large gaps so that the immune cells can pass through easily. But when it becomes more and more, our blood fluids will pass through and start collecting near the organs. When fluid moves out, these RBC, WBC and platelets which have to move through the blood vessel might get jammed and the blood may start clotting. When the blood clots, other organs may stop receiving proper blood flow, which may lead to organ failures, or it may so happen that the organ also might be infected and similar process has happened near that organ too. So it's a tricky situation when our body's own immunity goes into an override, that is, it go against and start killing healthy cells and organs. And hence, timely treatment becomes very important because if the treatment gets delayed, the organs may fail. If the medications are given when it is not required, then it may suppress our immune system at a stage when our immune system was helping our body. How can we detect it? There are some symptoms that we may look for. like high fever, neurological symptoms, shivering, coma, or the patient may get unconscious for some while. Septic shock means the infection may get into blood, spread to different organs, and blood pressure of the patient may go very low. And pneumonia is something which is very common in COVID cases. And diagnostically, we can detect it from spike in some of the marker proteins like ferritin, which is a plasma protein, CRP, which means C-reactive protein, which is generally there in blood test, and IL-6, interleukin 6, which is a pro-inflammatory cytokine. Spike in these marker protein values may indicate a cytokine storm. But I am very cautious and specific when I am using the term indicates, because spike in these proteins mostly indicates immunoresponse for any infection. So only the doctor will get to know the difference between is it a normal reaction or is it a cytokine storm reaction. And if it's yes, are there any medications for it? There is no specific drug for cytokine storm which is induced by COVID-19, but there are some of the drugs which are being used in the treatment like tocilizumab, sarilumab, siltuximab. All of these drugs will reduce the concentration of IL-6 cytokine. And there is another drug called anakinra which will inhibit IL-1 cytokines. And there are several other steroids and other immunosuppressant drugs which are given in this situation. And all of these drugs will suppress the immunity. So it is very, very important that these drugs should be taken only after the consultation of a professional doctor and should not be taken without consultation. As these are immunosuppressant drugs and will reduce our immune response, it becomes very important to take some of the precautions during this time. But before going to precautions, I want to inform you about why you should take precautions. You might be hearing about mucormycosis, which is also called zygomycosis. In general, it is also called as black fungus. There are millions of fungus and virus around us, but our immune system is so strong that all of these won't affect our body at all. But when our immunity is suppressed, some of these microorganisms can make our body home, and some of the major cases we are finding is of mucormycosis. And this fungus may be there in the air, particularly when the air is humid. So you can use a dehumidifier or air purifier in the room where the patient is there to avoid the chances of getting this fungus. Thrombosis, which is blood clotting. We are hearing a lot of cases in which the patient was recovering, his oxygen level was getting fine, but all of a sudden he passed away. And you already know why blood clots. And this mucormycosis is something which is very rare. You don't have to be afraid of it, but to avoid even that chance, taking precaution is a good thing. First precaution is having a clean environment. The room in which this kind of severe patients who are recovering are there must be cleaned often, and there is something called humidifier in every oxygen devices. One should make sure that the water which is filled in this humidifier is drinkable water, either aquaguard water or mineral water, and not tap water, because fungus will grow in humid places. So making sure that the water is clean and the mask and the oxygen cannula the patient is using is clean. And as doctors are overburdened these days, they may miss out on recommending you blood thinners. And it's not that all patients require blood thinners. Some of the patients who are recovering may need blood thinners. So if the doctor has not recommended you, please do ask him whether you need blood thinners or not. And you can have second opinion of another doctor if you feel so. If you take these precautions, the mortality rate could be reduced. Testing yourself in the initial stage and get the proper treatment at the early stage most probably will avoid you from getting into these kind of situations. Hope these informations are useful and reach the people who need this information. And hence, even if you don't click the like button or subscribe to the channel, please do share this video so that this information reach maximum people, because we don't know who will need this information at what time. Thank you for watching this video.